Lesson number 5 is on the rules on numbers. Have you heard of The Secret Lives of Numbers by Goland, Levin et al.? The authors of The Secret Lives of Numbers conducted an exhaustive empirical study in order to define the relative popularity of every integer between 0 to 1 million. The resulting information exhibits an extraordinary variety of patterns which reflect our minds and body. For example, certain numbers such as 212, 486, 911, 1040, 4092, 1776 occur more frequently than their neighbors because they are used to dominate the phone numbers, computer chips, famous dates, or progress that figure prominently in our cultures. Do we really need numbers? Like most people, initially number meant whole numbers, 0, 1, 2, 3, and so on. Whole numbers make sense. They provide a way to answer questions of the form, how many? In medical transcription, numbers have different uses. They may be used to indicate the dosage of a medicine, the age of the patient, the size of an incision, or the stage of a certain disease. As we proceed viewing this lesson, we shall deal with the rules on numbers as applied in our medical reports. Here are some of the general rules we need to follow. First, spell out numbers 1 through 10 when they appear in the narrative section of the report. When one numerical expression follows another, for clarity, spell out the one that can easily be expressed in words. Examples are, the patient will return in 1 week. The patient is to drink 2 6-ounce glasses of milk every day. Second is to use figures with technical information as in our age, vital signs, height, weight, and dosage. Examples would be vital signs showed blood pressure of 130/90, pulse 72, respirations 20, medications ERYC 250 milligrams BID, or white cell differential count showed 78/6. When numbers are with abbreviations, symbols, and measurements, always use figures. Note that no space should come between the number and its symbol. Examples are pulse 2+, 100% oxygen, reflexes 5/5. But there is a space between the Arabic number and the corresponding unit of measure, abbreviation, or symbol. When we hear 9 milligrams, we transcribe it as 9 space milligram. For ordinal numbers, they are spelled out especially when the series goes no higher than 10 items. Exception is when a date is used with a month. Here are a few examples for this rule. His return visit would be on the 15th of September. Some notes to remember is that the vertebral or spinal column segments are referred to in Arabic numerals 1, 2, 3, 4, 5, so on. The 12 pairs of cranial nerves, however, are referred to in Roman numerals. Therefore, in transcription reports, we refer to the cervical spine as C1 through C7, thoracic spine as T1 through T12, dorsal spine as D1 through D12, lumbar spine as L1 through L5, sacral spine as S1 through S5. But cranial nerves 1 through 12. Arabic numerals are also used when referring to EKG leads, cancer grades, and both conventional and military time. 0 is always spelled out when used alone. These are some of the rules on numbers that we need to remember. You shall apply this in your future transcription reports. These are just some of the basic rules our style guide and medical transcriptionists must remember. In the succeeding lessons, we shall deal more on other rules. Thank you for watching Cetasi's Paper Review University, your classroom inside your TV set. My name is Adora Amor Balawan, your medical transcriptionist trainer.